early in the morning at 8 in the morning in the beautiful city of Madrid. My name is Luis Gutierrez. I come from Spain, from the south of Spain, from Andalusia, from a small, very beautiful town from Granada, in the University of Granada. I invite all the people to go there because it's a beautiful city. And it's a pleasure for me to be here in this free oral communication. We are going to have 10 oral communication in the morning. So I would like to be at least 9 minutes or 10 minutes, but if we want to have any question at the end of the presentation. So the first one is with our colleague, João Victor Bueno Ferrão. He comes from Brazil, marvelous country. And he's going to speak about dissecting the phenomenon of suicidality in patients with obsessive compulsive disorder and descriptive psychopathological style.
So, hello everyone, my name is João Victor Bueno Ferrão, as Dr. Gutierrez presented me. I'm very honored to be here among you guys to present my work called Dissecting the Phenomenon of Suicidality in Patients with Obsessive Compulsive Disorder, a descriptive psychopathological study. So, I will be dividing this presentation into 4 parts. We will start with introduction and objectives. So, looking at the literature, we can see a lack of conclusive information about suicidality and obsessive compulsive disorder. So, in order to fulfill this empty spot in the literature, we aim to describe the psychopathological features of the aspects of lifetime suicidality in obsessive compulsive disorder. We did that by performing a case control study using some instruments. We will talk today mainly about DETECT tests, but we also used another instruments like back depression and anxiety inventories. We used family and history of psychiatry disorder inventories to assess some social demographic data, and another inventories that will be further discussed. So, talking mainly about DETECT tests. DETECT test is an health app developed by Dr. Andreotti at Universidade de Ciências da Saúde de Porto Alegre, a university at my city in Porto Alegre, Brazil, and it was developed to help health professionals to assess suicide risk in hospitalized patients. It is made out of 24 questions about suicidality that we'll further discuss each topic of it. So, our population was made of 241 patients, 114 with obsessive compulsive disorder, and 127 inpatients of a general hospital were our controls. Still talking about our population, we had a mean age of 36 years old for the OCD patients, and we had an older control mean age of 60 years. Mostly of our patients were women, were single, and they did not have children. Talking a little about clinical data of our patients, quarter of our patients had asymmetry as the most prevalent symptom dimension. They were followed by aggression and contamination or claim. In the Yale-Brown Obsessive Compulsive Scale, the score was 18 points. That was a moderate symptom severity score. Talking about comorbidities, depression was the comorbidity that we found the most, with 35% of patients having it, and it was followed by generalized anxiety disorder and social phobia. We found that over 90% of our patients had used SSRI during their life, and more than half of them were submitted to cognitive behavior therapy. In this box plot graphic, we can see that we found no difference between OCD patients and the control group. And that's interesting to see because like I showed before, our control group was made of inpatient patients, and our OCD group was all made of outpatient patients. So due to that, we've decided to focus on looking at the different questions that we made to assess better the clinical features of the psychopathology of OCD. So patients with OCD reported on the TEC test less will to live, a greater will to die, more reasons to die, greater lifetime history of suicidal ideation, acceptance of the idea of death. They admitted death as an escape. They had a suicidal plan in the past. They also had a suicidal plan in the last week, courage and ability to commit suicide. They showed no organization for the afterlife. They have talked to others about suicidal ideation. They had easy access to a method or opportunity to kill oneself, and they suggested to have family members or friends or close persons that had attempted suicide. We found no difference from the controls in another questions like suicidal desire or plan in the near future, and the success rates of suicide in close people. So the results that we found that there was a moderate and direct correlation of suicidality and obsessive compulsive disorder severity on the current moment, and that's due to the severity of compulsions and the severity of depressive symptoms. We also found a direct correlation on the mean rate of lifetime improvement of symptoms. Another finding was a moderate and indirect correlation with the total quality of life scores, like the physical aspects, the psychological aspects, and the environmental aspects. Our study had some limitations. Firstly, our sample size. The study had a limited sample size. We had no comparison with the gold standard of the suicidality. We had a controversial control group, as our patients were all inpatients, and we had unassessed some factors, like the types of OCD symptoms, the presence of sensory phenomena, if the family history of OCD and suicidality was positive and how it was, and the age of onset at the obsessive compulsive disorder. So the conclusion that we found was that the suicidality appears to be markedly present on patients with obsessive compulsive disorder, even when compared to inpatients from a general hospital. A detailed approach to suicidality in obsessive compulsive disorder patients can aid in therapeutic planning and reduce patient suffering. And looking at the clinical features can help us to help our patients. Thank you.
Thank you very much, Joao. There is any question for the audience for Joao about the oral communication for me? It's very interesting. I asked myself, because there